20 people are joining. Hello, everyone, and welcome to today's session of the 2025 Global Collaborative Series, Aligning Advanced Practice Nursing with Global Sustainable Development Goals. This monthly event is made possible through the generous collaboration of our esteemed partner host, Dr. Jean-Marie Staccherini, Professor, Associate Dean for Global Affairs, and Director of the Pan-American Health Organization of the World Health Organization Collaborating Center at the University of Michigan School of Nursing. We also are partnered with Yale School of Nursing, so we welcome our partner, Dr. Asia Nupane, who is the Director of Global Affairs and Planetary Health at Yale School of Nursing, and Megan Allen, Doctor of Nursing Practice candidate at Yale. Thank you to our partners for your dedication and contributions to this initiative. Each month, we'll take turns hosting this important series, and we encourage everyone to stay engaged by registering for future sessions. Now it is my pleasure to introduce today's speaker, Dr. Carol Ziegler. Dr. Ziegler is a professor on faculty at Vanderbilt University School of Nursing in the Family Nurse Practitioner program. She earned both her MSN and DNP degrees from Vanderbilt in 2006 and 2012, respectively. Before becoming a family nurse practitioner, she worked as a registered dietitian in a small Appalachian community in eastern Tennessee, and she conducted nutrition research at the University of Tennessee, focusing on the anti-cancer properties of phytochemicals. Dr. Ziegler's global health journey began in 2009, working with traditional healers in Western Kenya to protect traditional knowledge, improve primary care access, and promote forest preservation through market-based strategies. Domestically, she has 10 years of clinical experience as a family nurse practitioner serving underserved urban communities in Nashville, Tennessee. Since joining Vanderbilt's faculty in 2013, Dr. Ziegler has taught in the family program and nurse midwifery programs and has coordinated global health initiatives for our school. Her current work focuses on innovative community-based strategies to improve outcomes of health in underserved populations and educating future providers on the critical role they play in advancing climate adaptation and mitigation policies. Please join me in giving a warm welcome to Dr. Carol Ziegler as she shares her expertise with us today.
Thank you so much for that introduction. Can you all see my slides okay? Yes. Okay. I'm really excited to be here with all of you, and I see current students and a few former students, so thank you all so much for joining. And so what I'm going to talk about today is how we can use the planetary health framework to advance the sustainable development goals and how all these things align across nursing education, practice, policy, and we'll talk a little bit about research as well. I post this slide because I want you all to have access to my email. Please email me after this if you have questions. I would love to talk more about this. And when you also feel supported and like you have resources, I will share resources at the end as well that I have used and that are really helpful in sort of advancing this across education and practice. So our objectives today are to first examine the basic tenets of planetary health as a meta-paradigm, look at the alignment between nursing and planetary health as far as the meta-paradigm structure goes. And then we'll talk about the critical role that APRNs play, and nurses across the board really, in advancing both the planetary health meta-paradigm and the Sustainable Development Goals. We'll talk about where we are with both and kind of where we need to go. And then we'll share how to prioritize actions for nurses across education, practice, and advocacy that advance those goals. And I want to stress, because there's a lot happening right in our country right now and across the globe. And sometimes it can feel daunting, especially in these spaces where we're talking about health equity, climate change, planetary health. But I want you all to remember this. A wise woman said this to me yesterday, in fact. She said to me, all action and all politics are local, and all impacts are global. So that just gave me a lot of hope when we think about these sort of challenges that we face and how we can work together to advance those. And I'm sure in the discussion, we can talk more about that. So I want you all to think about what planetary health is to you, whether you've heard of it as an academic concept or a practice strategy or not. Kind of think about what it means to you now when I just say the words. How do you think it looks as a concept in practice? How would you advocate for it? And what do you think you're seeing happening in your communities? And so it is this sort of emerging field and social movement, but it is not new. Planetary health is rooted in indigenous values and knowledge systems. It is solutions focused. There is research involved in planetary health, and that's part of the paradigm, but the research is not just for the sake of generating knowledge. It's really to see change happen and to realize impact. So we want to focus the research on scaling up the things that work and scaling back the things that are not effective. It focuses on acknowledging and addressing the disruptions caused by human activities to Earth's natural systems. It integrates global health, environmental health, the One Health concept, which involves agro practices, and ecosystem health into a comprehensive framework. So it's sort of a really good sort of overarching theme for all those frameworks together. It is transdisciplinary and it is evidence-based, and it is a very, very upstream approach, right? To attaining the SDGs, to attaining health equity, and just broadly, when we think about global health and planetary health, we look at really upstream causes and solutions to problems. And it really centers health equity and environmental justice at the core of the practices, the policies, et cetera. And so within the sort of planetary health meta paradigm, there's now a planetary health education framework. And I share this website, the Planetary Health Alliance, at the bottom. If you go to their website, you can access slide decks, documents with the framework, et cetera. So that's a really good resource to have. So the framework involves these 5 tenets. One being interconnection with nature, the Anthropocene in health, which I'll talk about in just a minute, systems thinking and complexity, equity and justice, and movement building and systems change. The term that's being used is the Anthropocene for this new sort of epoch we're in, and that refers to the fact that humans are having this massive impact on the planet. I take a little bit issue with the term because humans across the globe are not equally impacting the planet, right? It's certain ones at certain places that are having a greater impact. So we'll talk about that more when we talk about health and equity. But these are sort of the tenets of the framework. So when we think about it in nursing, how do we integrate these concepts and practices into nursing education? What do we need to break down what we already have? What do we need to scale up? And what questions should we ask? So how do we advance these ideals in the current academic and political environments? And that brings us back to the nursing model, right? I think I have noticed, and colleagues have noticed, that over the past years, I would say decade or so, there's sort of a growing concern that nursing schools are not really teaching nursing theory anymore, right? And so where this used to be sort of embedded into nursing education, because the curriculums are so tight and there are so many clinical skills and concepts that we need to teach, and the increasing need for clinical hours, in some cases, sort of the theory has gone away. But the theoretical knowledge is really important. And the reason I bring this up is because environmental health and planetary health has been sort of baked in to nursing, right? And so when our new graduates are not aware of that, it's harder to draw these lines. But I think for nurses that have this background, it's really easy to see that the nursing model, the planetary health model, kind of seamlessly align, right? And so we'll talk about why that's important to addressing and advancing the SDGs. But I just want to bring you all back to this. These are the foundations of our practice, right? And so within the nursing meta paradigm, it's very simple. It is the person, their health, the environment, and the nurse. And if we think back to our foundations, nursing was very focused on creating an environment that promoted healing, right? So we're very focused on making sure air quality was clean, that the water was clean, the person's environment was healthy so that they could then heal. And so I want to really encourage us to draw those lines between the roots of our practice and where we kind of need to go. It's not too far of a jump, really. So if we think about what ways nursing currently aligns with planetary health, and we go back to those 5 tenets, we do have baked into our model an interconnection with nature, right? This idea that how well our environment is doing is going to affect the health of the humans walking around the planet. We do definitely have systems thinking and complexity. We are now getting better at talking about equity and justice and bringing in social determinants of health into nursing curriculum. And I think we'll talk about why nurses are really good at this movement building and systems change and why we need to get better at it. But if we think about these 2 sort of paradigms. Where do we already have great alignment, and where do we need to make adjustments? And I would just encourage you all to think about that in your programs. Students, think about that and talk to your faculty, because I think nursing is really in a position to lead in sort of pushing the planetary health meta paradigm out into the rest of academia and the rest of the professional world as well. So now this is sort of the basis of my presentation, I would say. So when we think about how are all these things aligned? So nursing, planetary health, and the the sustainable development goals. And so I want you to think about it in terms of planetary health really offers a framework. And then co-benefits, which I'm going to speak about in just a little bit, offer sort of day-to-day practice strategies to advance the SDGs globally. Okay, so both frameworks require collaboration across disciplines and sectors and nations to address the very complex interconnected challenges that are making it difficult for us to achieve the SDGs. The planetary health acts as a guiding framework for implementing the SDGs in a way that really ensures long-term sustainability, right? So it's a broad concept that really aims to understand how changes to the environment at various scales, be they global, regional, local, impact human health and well-being by emphasizing those interconnectedness between human activities and natural systems, ultimately advocating for holistic solutions to address environmental changes and challenges, and promote sustainable development across different sectors for present and future generations. Sometimes things seem so chaotic now, we forget about the future, but we really need to think about the impact this is having on future generations. And so we can really focus in these areas, this holistic approach to health and sustainability, environmental sustainability broadly, socioeconomic inequality, food and nutrition is a big place. We can have a lot of impacts. Climate change and resilience, and interdisciplinary, interprofessional collaboration. So those 6 things are areas we can really focus to move these agendas forward. So I want to talk about now sort of where we are, both in terms of planetary health, and then the next slide is going to talk about the SDGs. So this is our crisis currently. About half of our temperate and tropical forests have been cleared. We're losing biodiversity at a rate of about 150 species per day. Our oceans are more acidic. We're seeing dramatic changes in land and increasing desertification. We have pollution across soil, air, water, right, that's affecting human health and animal health. We're exceeding planetary boundaries for CO2, nitrogen, and phosphorus, as well as other gases and pollutants that impact our environment. Over 60% of our rivers have been dammed. We're seeing increasing extreme weather events that are devastating communities. We just had these, massive wildfires in the West. We're seeing now, I think New Orleans had 8 inches of snow yesterday. So weather is getting weird, right? We're seeing a lot of changes. Temperatures are on the rise. Last year, or 23, I believe, was the hottest year on record, and air quality is declining, and sea levels are rising. More broadly, I think we're seeing this across the globe. Human beings are disconnected from themselves, from each other, and from their planetary home. And so what are ways that we can think about that as nurses in education, practice, policy to stop this crisis and move things forward? I'm sure you all are familiar with the SDGs. The SDGs basically provide us with actionable targets and measurable outcomes that align with the principles of planetary health. So together, planetary health and the SDGs underscore the importance of maintaining a balance between human development and the health of the planet, right? So we can ensure a sustainable future for everyone. We have to advance planetary health in order to attain these SDGs. So where are we now in terms of sustainable development goals? I just had a chance to look through the 2024 report on the SDGs, and we're making progress on some, but we have a long way to go. So this year's report revealed that only 17% of the SDGs targets are on track to be achieved. Nearly half are showing minimal or moderate progress, and progress on over a third has stalled or even regressed. So we have a long way to go. You guys can access the report. That's the link at the bottom. And I just want to share some sort of shocking facts I gleaned from that report. So one is that 2023 was the hottest year on record across the globe. Since May of 24, 120 million people have been displaced. We've seen a 72% spike in civilian casualties in global conflict. And currently 23 million people are living in extreme poverty. So who is most vulnerable? And these groups are vulnerable to impacts from climate change and health, and also typically are the most impacted by us not attaining the SDGs. So these are populations that are targeted by the SDGs, and these populations exist in all nations across the globe, right? So people at extremes of age, so they're very old and they're very young, pregnant women, low-income communities, communities of color, people who, based on where they live or work, are exposed to the elements, so exposed to pollution, exposed to extreme weather, exposed to heat, exposed to conflict, right, we could say. Generally, the global south is having a harder time than the global north, and then anyone who has underlying chronic diseases, including mental health conditions, that make their ability to adapt or their capacity for resilience decreased, right? So when we think about it as APRNs, the people that we work in all of these groups, right, with all of these communities. So we can really have a vast impact on advancing these issues. So why nurses? Why are we talking about this? Why was I invited to come and talk to you all? And why do we need to be leading this discussion at the forefront? So congratulations to all of you. We are now for 23 years in a row, the most trusted profession, right? So we have social credibility, we have public trust. We are what I see in day-to-day life with my faculty colleagues. I see some of them on the call, with students I have now and I've had in the past. We are unbelievably innovative, y'all. Nursing self-selects for people who want to help and are innovators. I've seen nurses in the clinical setting invent amazing things just on the fly, right? You all know what I'm talking about. So we're innovative. We also have a really highly valued technical skill set. But we're also able to have these sort of theoretical frameworks and sort of make abstract concepts very concrete for people. And that is so needed right now in this conversation. We have political power. We have economic purchasing power if we could unite, right? And we are everywhere. We are across the globe. There is a shared language amongst nurses that don't even speak the same language. There is this sort of this village that exists within our profession. And we also embrace people outside of the official profession, like so traditional healers, community health workers, they sort of are all kind of in this group with us. And most importantly, people get really excited when we show up. I will never forget colleagues of mine who are in leadership at ANNE, which is the Alliance of Nurses for Healthy Environments. When they were leading demonstrations at Capitol Hill, they shared with me this story that I think Jane Fonda was there and a bunch of folks were there. And when they showed up, everybody was like, "Oh, the nurses are here." This is when we were doing climate protest. And I have seen that across in my experience here. When we show up, people get excited because we're trusted, and because typically we have a lot to offer, right? So I want to encourage you all to keep those things in mind when you're thinking about what your role could be in these discussions. So we're the world's frontline healthcare providers, as well as the most trusted. Our advocacy is powerful and we're everywhere. We share a mission, we share a vision, we have a shared sort of language of practice, right? And so nursing is really a village. So what can we do when we think about action? I think about it in terms of, and that's what my little upside down triangle there is, personal action at home, which we'll talk about at the end, personal action at work, institutional action, and then local, state, national, global action, right? So we think about planetary health in education and practice and policy and in research at home, in the community, at your institutions and beyond, right? So how can we advance the SDGs through planetary health education, practice, and advocacy across all of these levels? And that's what we're going to get into now. And I really want to leave time for discussion because I want to hear what all of you, your ideas and what you have to say. So I would encourage you all to dig into this document. This is a wonderful evidence-based, collaboratively created document called the Sao Paulo Declaration on Planetary Health. It was published in 2021. It really gives a blueprint by profession and by discipline on what we can do to advance the goals of planetary health. And then also by doing that, we'll advance the SDGs. And so I want to share these with you all, and then I want you all to think about ways you can do it in your practices and in your work currently. So number one is to immediately incorporate planetary health concepts and values into the main curricula and professional codes of conduct for all future health practitioners, right? Two is to educate patients on the concepts of planetary health and utilize health practitioners' trusted voices, nurses being number one, right, to raise awareness about the adverse effects of our current dysfunctional relationship with our planet. 3, to draw upon the diverse knowledge practices beyond Westernized disciplines, including those of Indigenous persons. To advocate for patient-centered policies that advance planetary health, including public health access to health services as a human right, both locally and abroad, right? So when you think about that in terms of what does healthcare access look like in the communities where we work, and what does it look like globally? And then to incorporate solutions and community services beyond the clinic and also beyond the classroom. So what are things we can do that involve interprofessional collaboration, innovative solutions outside of our typical circles, right? So let's get into those things. So let's start with education. And this is an area, right? My main job is as a nurse educator. I do also have a practice. But when we think about reimagining education to incorporate those 5 tenets, so interconnection with nature, the Anthropocene and health, systems thinking and complexity, equity and justice, and movement building and systems change. How do we actually do that? And I don't know. Is the answer. I don't know. I know where to start, but because I was also educated in this sort of very westernized system, it's hard for me to think outside of the box. So I want to encourage you all to really try to think outside of the box. And also thinking about that sort of disconnection that is at the root, is the disconnection of us from nature and the planet from each other. How do we sort of heal that disconnection? Through education. We educate students, we educate colleagues, we educate patients, community members, policymakers, industry persons, and industry players ourselves, right? So we have to think of planetary health education as a new and currently forming pedagogy. And so where can we look for answers, right? And we need to look outside of the current system. It is sometimes hard to have these sort of changes materialize in academic institutions. So how can we think outside of the box? So these are some things that are in the literature and that I've thought about. So number one is, just like it said in the Sao Paulo Declaration, to integrate these concepts across our curriculum, right? And I'll talk about how we've done that here at VUSN. And then really think about clinical application. So when we're educating nurses and nurse practitioners, what are some little tidbits we can give them to practice this when they're just starting out in the patient setting? Like, how do you practice planetary health in a hospital or when you're with a patient? So we'll talk about those. To think about new pedagogical styles, and I think first and foremost to me in this respect is removing those hierarchies. So just kind of breaking down how we think about education and thinking about in nursing education in the hospital setting, what do hierarchies do, right? And how can we sort of start to break those down? Most importantly for us, for nurse faculty, for up and coming nurses, is to really inspire future leaders across disciplines, right? So that's one of the things I think I try the hardest to do, is to really share my passion for this, and so you all can see it, and then hopefully inspire other nurses to take action and think about things outside of the box as well. Remember the nursing model and those foundations and bring that back into our curriculum. I think the more we can show students that this profession they chose, this is already baked in, right? Care for the planet, care for the underserved is baked into our model. And so how do we bring those foundations back? And then really making sure that we're also educating the public also about what we do. I find that when I show up in some of these circles, like climate change advocacy circles with engineers and policymakers, it's like, oh, it's great you're here, but like, what does nursing have to do with this? And so I think really educating our colleagues and the public about what we do as APRNs, first of all, right? And as DNPs and also as advocates for these movements is really critical, because we are holistic, right? We integrate all these things together. So I want to share with you all some examples of things we've been able to do here at the School of Nursing. And please, if you have questions, please reach out. I'm happy to share syllabus, anything I can share with you to help you move things forward. So in 2018, we launched a university-wide course. It was called Planetary Health Policy and Social Justice. It was an interprofessional multi-level class. So we had first-year students, freshman students, all the way up to PhD engineers. They worked together in groups and the call for the class was to address a local health issue that impacted a marginalized community. And as you address it, you have to ameliorate the environmental impacts of whatever you decide. So let's say you're going to make sure that folks in low-income housing have air conditioning. Well, you got to plant some trees, right, to mitigate the carbon you're going to create with those AC units. So students came up with these projects, and then we rolled those out in the community. There was some amazing work that came out of that course. So then from that, we were able to integrate planetary health across the core curriculum when we re-looked at our curriculum to bring in the ANCC standards. We were able to integrate that across the core courses. So now all of our students, no one graduates without hearing about planetary health now at the School of Nursing. We've been really active with educating our peers we hosted a Planetary Health Summit last year, conference presentations, guest lectures across disciplines. So now, we've lectured in the School of Engineering and Arts and Sciences on planetary health and the role of nursing as well in that. So it's also a good way to be sort of an ambassador for nurses. In 2022, with university support, we launched the Climate Health and Energy Equity Lab. And I would love to talk more about that if we have time in the questions. But the point of that lab is really to find ways to creatively finance through carbon offsets and private donations, interventions in the community that improve health. And I'll talk about one that we've really started to focus on. One is weatherization. So in Nashville, some of the biggest pain points for folks have been energy poverty and housing. And so we've really focused on those areas. Another one is food insecurity. So looking at ways to sort of address those issues in the community with funds from donations from private companies that also offset carbon. Last fall, we launched the Planetary Health Policy Innovation Lab. We have 3 undergraduates, 2 PhD students, 1 MPH, and 4 advanced practice nursing DNP students that are working on local policy issues that involve environmental health and health inequity. So I'll talk about those specific projects here shortly. We have faculty and leadership around policy that advance planetary health locally and nationally. We're working on practice innovations and community action. And then sort of like what's happening right now, what you all are doing, this sort of global education and knowledge sharing. I would just encourage all of you, when you go present at conferences, just have a piece in there about planetary health, because we can relate everything we do back to the health of the planet, the SDGs, et cetera. So when we think about practice, and this is the part I get the most excited about, what are ways that we as nurse practitioners and nurses in our everyday practices can advance planetary health? And there's this beautiful space called the co-benefit space. And one of my first forays into both nursing education, advocacy, and policy was when I stumbled upon the Alliance of Nurses for Healthy Environments. And I'll tell my students this. I literally showed up to a meeting and they were like, well, do you want to chair the climate change committee next year? And I was like, sure. So I had a co-chair who was this brilliant woman, Jessie LeClaire. I think she's at the University of Minnesota still. And so we chaired for a year together. And really, that was a space I learned about all of this. So Annie is a great resource to go to if you want to learn more. But they put out a document. It was called the Nurses Drawdown. And some of this comes from that. But it was basically, what are those areas that in nursing practice we can at the same time address human health and planetary health? So co-benefits are those policies and actions and practices that simultaneously advance human health and planetary health. And really, these things are things that are required if we're going to reach the SDGs, right? We have to do them together in lockstep. Again, because many of us practice locally. Sometimes we feel like we can't advance the SDGs internationally with local practice, but we absolutely can, right? Through co-benefits. And so I want to just share with you some areas where you can focus. And these are evidence-based co-benefits and strategies that impact health for the patients that you're seeing and also impact positively the health of the planet. So I have a colleague who used to be at the EPA and is really involved in climate policy. And I asked him if there were 2 things if you only could do 2 things to improve the health of everyone on the planet, what would those 2 things be? He said, electrify the grid and clean transportation. So like electric vehicles are great, but if they're hooked up to a dirty grid, they're not that helpful, right? So if we have a clean energy grids and electric transportation, we can see a vast improvement. If you go back and look at the SDGs, many of them are related to pollution. Much of that comes from fossil fuel combustion. So if we can decrease fossil fuel combustion, we both improve air quality, and poor air quality is a cause of many of the top 100 causes of death globally. And also we decrease, if we have more renewable energy, it decreases energy cost burdens for people, right? So that's really significant. So renewable energy, clean transportation. The second area, and this is one where we really focus with the Climate Health Energy Equity Lab, is home weatherization and energy retrofits. There has been a lot of research done on sort of the folks that are having socioeconomic pressures, right, and have to make decisions about whether they're going to buy their medications, buy nutritious food, pay their rent, pay their energy bill, right? A lot of people are in that boat internationally. And so when we think about actions we can take to both improve people's health and improve the health of the planet, this is one really low-hanging fruit, piece of low-hanging fruit. So home weatherization decreases energy cost burdens for residents, right? Whether it be renters or homeowners. And also then people have more cash on hand, which a lot of issues, people just need money, right? They need cash. So their energy bills are lower, so they have cash on hand. And then that also decreases carbon emissions, right, from energy. And there's multiple health benefits, from mental health benefits to decreased pain from arthritis, decreased stress, which then we know, right, has multiple benefits for cardiovascular health, just from home weatherization. The third one there is clean transportation. So we think about clean transportation, that is clean electric vehicles. It's also walking, biking, ride shares. So things we can do to promote clean transportation in our communities and our cities, and making that transportation affordable. So how wonderful would it be if everyone who is below a certain income got free electric bus passes, right? So thinking about things like that out of the box that really can help people access healthcare, right? Access jobs. These are all areas that nurses, we can think of as part of our practice, things that we do. Number 4, I love plant-based diets. You all heard in my past life, I was a nutritionist. Across the globe, we look at research, folks that have adequate nutrition and plant-based diets, they live longer. They do really well, right? So one of the best ways to decrease your risk for cardiovascular disease and cancer is to adopt a nutrient-dense plant-based diet. At the same time, that decreased carbon emissions dramatically across the planet. And so that's one thing we can promote that will both improve cardiovascular health, improve weight in many cases if it's done correctly, and we can talk to our patients about that in practice. Along with that is having access to locally sourced seasonal produce and gardens. And there are some programs, like Nashville has one, where you can give patients vouchers for a farmer's market so they can have access to that. So we all know if we improve nutrition, right, we dramatically improve people's health. Promoting tree cover, especially in urban core environments where the heat now is deadly in some cases, right? And a lot of people don't have access to air conditioning. In Nashville, and I think across the board, there's no requirement for public housing to have air conditioning. So a lot of folks don't have access. And like in Nashville, Tennessee, it gets really hot in the summers. It can be deadly heat. Tree cover really does dramatically decrease urban core temperatures. And so one study we did in Nashville a couple years ago, we found that there was a 10-degree difference at night in the urban core versus outside of the urban core. And there's good evidence that planting tree cover, increasing access to green space can really decrease, can make it evening temperatures much cooler, and that really promotes health. Supporting breastfeeding is a major way to both decrease carbon emissions and improve patient health. One of my students is looking at a project now on how to get companies, how to make it economically advantageous for companies based on the carbon offsets to support working moms breastfeeding. So another thing we can talk about with our patients is just really finding ways to support, finding what people's barriers are and finding ways to support that to improve health broadly. Access to contraception is a huge way, and one of the main things that was discussed in the Nurses Drawdown to really promote both planetary health and human health. We know that gender inequality, women's health is a major issue in all communities. I know in Nashville, it was one of the top 3, right? Women's health, maternal and child health. So giving people that want access to contraception, if you're doing that, you are practicing planetary health. Thinking outside of the box with delivery models, right? So telehealth, people don't have to drive, and we're increasing access. And then global support. There is a nonprofit here I think it's called the Addis Clinic, that has doctors and nurse practitioners register to be volunteers, and they provide real-time live support on the ground for clinicians and community health workers in East Africa that are seeing patients. So thinking out of the box about ways we can support global health to achieve those SDGs with telemodels, right, and technology. That feeds right into that next one, which is lower carbon healthcare. Mobile clinics, meeting people where they are, so there's less people traveling to a place. That both decreases emissions and also increase access to care. And then broadly, optimizing baseline health for people, following the guidelines. And one of the best ways we can practice co-benefit is by promoting and investing in primary and preventive care. That was a lot. All right. We think about the clinical encounter. How do we promote resilience? So a lot of times we think about our role in terms of emergency preparedness, but we have to kind of get more broad than that, right? And so making sure we ask people about housing stability, access to air conditioning, optimizing that baseline health, including mental health, optimizing control of chronic diseases, thinking about the air they're breathing, especially for folks with asthma and COPD. So how can we, both from a personal scale, making sure people have access to HEPA filters and air quality monitors, all the way up to advocating for cleaner air policies, right, in our communities? How do we sort of advocate? Because that is all practicing planetary health as well. And then educating people about things like the heat index, air quality index, passive cooling strategies, how to, what strategies can they take to make sure their families are prepared when there's a tragedy. That all can fall under our purview as well as healthcare advocates, patient advocates, and clinicians. And also sleep, stress management, water, nutrition, right? So those things that we know are those, old school primary care preventive strategies. When you do that, you are practicing planetary health. So when we think sort of broad scale and outside of the box, these are things I want you all to think about in your lives, whether you're an educator, you're a practitioner, you're a policy person. What are some things you can do to sort of hit at these co-benefits broadly? So number one is interventions that improve health and alleviate economic stress, right? So energy cost burden relief, solar panels, home energy upgrades for low-income homeowners. In Nashville, we have a program with NES called the Home Uplift Program. So with the energy utility, where people can get energy upgrades paid for if they are below a certain income. And then that increases energy efficiency and decreases that cost burden. Promoting renewable energy and clean transportation. And then along the lines of like that tree cover we talked about, nature-based solutions for climate resilience, which can look like managing land use to reduce emissions and mitigate heat. Those are all things that nurses should be speaking about. So these are things that impact health directly, so we should be at these tables. Policies promoting COVID benefits, and then thinking about education broadly. How do we make sure from, preschool all the way through graduate school and beyond, people are educated about planetary health, climate change? What are some strategies we can use to make sure we're sort of spreading the word? Because we are so trusted. So I shared we have this planetary health policy innovation lab that we just launched in the fall. We have 3 undergraduates, 2 PhD students, 1 MPH, and 4 DNP students who are nurse practitioners. So these are just some things we're working on. And if you have questions, I would love to address them specifically after the presentation's over. But these are just some ideas. So these are strategies where students are researching background, and then we're going to propose policy to the Metro Council, institutions, et cetera, to have some impact. So promoting breastfeeding, nature prescription toolkits, heat mitigation policies, expanding access to energy retrofits for low-income homeowners, energy bill credits. One student did this fabulous project where he looked at the health impacts of clean versus dirty energy grids, sort of scaled out by like 3-mile radiuses. And so just getting research and practice ideas in place where then we can change policy broadly to have broad impacts. So we'd love to talk to you all about that. And I want to share this. When we think about advocacy, our sector is a problem, right? And so if we do nothing else, we need to start at home, both with our own homes and with our sector. So if the global health sector was a country, it would be the 13th largest emitter of greenhouse gases in the world. The US sector accounts for 10% of our carbon emissions and 18% of our GDP, right? So per capita carbon emissions correlate with per capita healthcare expenditures by state. So if we think about that, states that invest more in primary care have lower per capita carbon emissions. So thinking about the role of nurses in primary care is really significant, right? If we can shift towards a primary care model and really reduce unnecessary care, we decrease health-related pollution and carbon emissions, we decrease cost, and the secondary disease burden that is caused by those emissions. If we look at where's the carbon coming from in the health sector, about 70% is the supply chain, so pharmaceuticals, chemicals, food. 11% is purchase power, and then the remaining is direct emissions from things like anesthesia gases, et cetera. So if we think about investing in primary care, and then within your institutions and beyond, really, what are the priorities for advocacy for our sector as nurses within the healthcare sector, right? We have to remember we have purchasing power, we have numbers for sure in nursing, and we have public trust. We really need leadership, right? And so these are some things that are currently happening and things that we can think about. So regulated accountability, which is going to include things like mandatory reporting of emissions and waste, benchmarking, Joint Commission could get involved, which I think that's starting to happen, and then linking payment from insurance payers to how well hospitals are doing, right, with emissions. Decreasing resource utilization and decarbonizing the power. I know Vanderbilt Medical Center has really tried to increase the power they're getting from clean energy from solar panels, and actually have invested in solar panels in more remote areas of Tennessee. So that's something that we're doing here. Investing in primary care and then educating our students and each other about the impacts of carbon emissions, planetary health, right, on the people that we're taking care of. So when we think about APRNs and advancing planetary health and the Sustainable Development Goals, and my students in my class here right now know what I'm going to say, because I've said it before. So I would encourage all of you to really strive for leadership roles. I have noticed that whenever I walk into a room, people are so excited to have a nurse that is a frontline provider there. And people trust us. People get really excited. So I want to encourage you to strive for those roles, run for office. People always laugh when I say that, but seriously, if we had nurses and nurse practitioners who are aware of this in leadership positions with the knowledge we have, with we convince people to quit smoking every day. Like, we can convince people. So we really have this unique, very technical and very soft skill set combined that make us really effective advocates. Get on boards and set agendas. So get yourselves on local boards of health. There's a nonprofit called, there's one called Run for Something, and there's Nurses on Boards, where you can register and they will send you an announcement. Hey, there's a board that has an opening, you'd be a good fit. So things like that, keep those things in mind. Keep the Sustainable Development Goals, planetary health front and center of your education, your practice, your research, your advocacy. Just think about it every day. Have it be that thing that you look at right when you wake up in the morning. Like, what can I do today to advance this agenda? Share your stories with people. Inspire each other, inspire students, inspire your faculty, inspire your patients and the people that you work with. And then most importantly, I think, is join your nursing organizations, which I'm going to talk about here on the resource slide, and really support with your dollars, with showing up, support nursing organizations and sort of alignment. Like, let's all get together and get our agendas aligned. Educate, practice, advocate. These are all things we can do to advance planetary health and also then advance the SDGs. And so I want to end with a sort of a personal call to action, because I really believe all these things start super locally, like at home, right? And so thinking of things that we can do when we look at our biggest impact on the planet by family, it typically is number one, it's your home. So your home energy footprint mainly, then is your transportation, then is your diet, then your clothes. So like the fast fashion concept, right? Then healthcare, and then entertainment. So thinking about things that we can do to sort of decrease our own footprints and our own impact is significant. And number one is slowing down. When we think about how fast we're all moving, and sort of when we go back to those tenets of planetary, how do we change our culture and our value system, where we're not constantly thinking about growth in a way that is destroying and destructive, and marginalizing people. When we think about how do we do that, the first step, I think, is slowing down, right? And really trying to keep perspective and put things in perspective. It's building relationships across hierarchies and social structures that are lasting and meaningful, and really partnering with individuals, families, communities, beyond whatever our agendas are, right? To really invest in them. It is simplification. So there's a concept called zero waste. There's an author, I forget her name, wrote a book called Zero Waste Home. It's like, how do you change your grocery shopping, your consumption to really decrease your footprint? And there's some really easy things that we can do, right? Home energy retrofits. I did personally invested in solar. My energy bill, y'all, is way lower than it used to be. There's a tax write-off for that. So there was, I don't know if there will be going forward, but really investing and kind of putting our money where our mouth is, in our own homes, thinking about gardens and lawns. Like, is a garden better than a lawn, right? Just thinking about in our own lives, what are things that we can do? Adopting plant-based diets as frequently as possible. And then most importantly, I think, is that active citizenship. So voting, speaking up, writing op-eds, calling your representatives and really advocating for yourself. And advocate as an individual and as a nurse, because again, we're so trusted. People really respect what we have to say. So thinking about ways to center these principles in our practice and in our lives, and then supporting each other, because it can be sort of a tough walk. I want to share these resources. These are some great resources for you all going forward. American Nursing Association has a guide, a planetary health resource guide for nurses. There is the Alliance of Nurses for Healthy Environments, which has policy, education, practice, and a climate change group. I think they meet every month still, really wonderful group. You will meet colleagues that are doing super creative things in these spaces. There's the Nurses Climate Challenge and the Planetary Health Alliance. Practice Green Health is an organization that is led by a nurse, Shanda DeMorest, who also was leading Nurses Climate Challenge. And you can go on there, like if you want to advocate for your institution to decrease their footprint, they have pre-baked letters. Where do you start? Should you start with anesthesia gases or your energy bill, right? So kind of it's stepwise. You can join that organization. They'll give you advice on how to move that forward in your institutions on a big scale. The National Academy of Medicine now has a whole toolkit out for physicians and nurses to really practice climate smart medicine and healthcare. And then Healthcare Without Harm is there as well. That last link is for science-based target initiatives, which kind of prioritize where should we start to really have the biggest bang for our buck in planetary health and climate. So we just encourage you all to look there. And then thinking about storytelling. This is an avenue that I think is powerful, both for students, faculty, practitioners, for patients, to really get stories out. What planetary health impacts are you seeing in your communities? Who is the most impacted? And how can you re-envision your own practice, whether it's teaching, education, policy, research, to sort of center planetary health so everyone can, all boats can rise. So those are just some thoughts I want to leave you with. These are a list of references. And I will share this with Dr. Kapoor. And that is all I have. I'm going to stay on because I think we're going to have some questions now.
Yes, thank you so much. So we'll stop the recording so that we can open